Anticoagulants and you.
This presentation will introduce you to some important information about the anticoagulation medication you are about to start. Although there are many different types of anticoagulants, they will all work in a similar fashion. This video will go through a lot of new information, but don't worry if you can't remember it all right away. You will be provided with a handout you can take home with you. This presentation will cover information that pertains to the injectable anticoagulants known as dalteparin or Fragmin, enoxaparin or Lovenox, tinzaparin or Inohep, and fondaparinux or Arixtra. It will also cover oral anticoagulants such as dabigatran or Pradaxa, rivaroxaban or Xarelto, and apixaban or Eliquis.
What do anticoagulants do?
Anticoagulation is a big word that can be broken into simple terms: anti meaning against, and coagulation meaning clots. Preventing clots means your body is less likely to form harmful clots in your blood vessels or heart. Clots that are already there are less likely to get bigger. Clots are also less likely to break off and travel to your heart, lungs, or brain, which can cause further illness.
What are anticoagulants used for?
Some medical conditions and surgeries can make it more likely that you will get blood clots inside your blood vessels. In addition, anticoagulants can be used following a severe clot, such as a deep vein thrombosis or pulmonary embolism. Other medical conditions anticoagulants can be used for include atrial fibrillation, ventricular dysfunction, heart attack, heart valve replacement, stroke or transient ischemic attack, or following surgeries such as knee or hip replacement.
So, how long do you take anticoagulants?
It depends.
On what?
It depends on the type of medical condition and what you're using it for. Your healthcare provider will decide the most appropriate length of time for your specific situation. For example, if you have a heart attack, you may need to be anticoagulated for a minimum of 3 months.
How do you use injectable anticoagulants?
These anticoagulants are given through subcutaneous injections, usually once a day. Ask your healthcare provider for a demonstration on how to inject this medication. They should be injected at about the same time each day.
How do you use oral anticoagulants?
These anticoagulants are taken orally at the same time or times each day. Check with your healthcare provider on the specific dosing for your oral anticoagulant. Some things to remember are that doses should be taken at about the same time each day. If you're planning on traveling, make sure you talk to your healthcare provider. Never stop taking your anticoagulant unless your healthcare provider tells you to.
What should you do if you miss a dose?
Take a missed dose as soon as you think about it. But if it is almost time for your next dose, don't take it. Only take your next regularly scheduled dose. It is important to never double your dose. If you're concerned about your missed dose or have missed more than one, contact your healthcare provider for advice on what to do.
What factors can affect how my anticoagulant works?
Other medication can also affect your anticoagulant. When you fill new prescriptions or start a new over-the-counter product, herbal, or vitamin, always remember to ask your pharmacist, will this medication affect my anticoagulant? Asking about over-the-counter medications is especially important for pain, fever, cold, and stomach medications. You should also avoid sports where injuries and falls are common. Let your healthcare provider know if you change your exercise program or have a large weight gain or loss.
Are there any side effects with this medication?
The most significant side effect is the increased chance of bleeding. Expected signs and symptoms include normal cuts taking longer to stop bleeding, more nosebleeds than usual, easy bruising, bleeding gums when you brush or floss your teeth.
You do not need to tell your doctor about these normal side effects right away, but you should mention them at your next regularly scheduled appointment. Tell your doctor right away if you see any other bleeding, like blood in your stool, blood in your urine, bruises in odd places, or if a cut bleeds for longer than 20 minutes.
For injectable anticoagulants, some people notice skin irritation where the shot was injected. Remember to rotate or change the site of your injection regularly. For oral anticoagulants, some people can experience stomach upset or heartburn when on this medication. Taking the medication with food can help with these symptoms if they are bothersome to you. Seek medical attention for any unusual bleeding or symptoms that concern you. Forgetting to take your anticoagulant as directed by your healthcare provider can put you at risk of clot. This is why it is extremely important to take your dose every day as your healthcare provider has told you to.
How would I know if I have a clot?
Depending on what condition you have, clots can form in different places. For example, following a deep vein thrombosis or pulmonary embolism, you should watch for the same symptoms as the first occurrence. In the cases of atrial fibrillation, ventricular dysfunction, heart attack, or heart valve replacement, you should watch for symptoms of a stroke or heart attack. A clot has the potential to cause a stroke, so you need to watch for symptoms of a stroke, such as change in vision, hearing, or speech, numbness or tingling in the face, arms, or legs, difficulty using your arm or hand, getting dizzy or fainting. A clot may also cause a heart attack. Although symptoms of a heart attack can be different for everyone, some typical signs include chest pain that radiates to the arm, jaw, or neck. Now that you know a little about anticoagulants, you understand how important it is to tell all of your healthcare providers, like dentists, doctors, pharmacists, and nurses, that you are taking an anticoagulant. Consider getting a medical alert bracelet so that in an emergency situation, your healthcare team knows that you are taking an anticoagulant.
Let's review. Anticoagulant do's.
Do take your anticoagulant every day as you are told. Do keep all appointments with your healthcare providers. Do get all your prescriptions filled at the same pharmacy. It is important that your pharmacist has a current list of all your medications. Do check with your healthcare provider before starting or stopping any prescription, non-prescription, or herbal medications. Do talk to your healthcare provider if you are pregnant or plan on becoming pregnant. Do call your healthcare provider if you have any signs of bleeding. Do rotate the injection site of your injectable anticoagulant. Do tell all healthcare providers, including your dentist, that you take an anticoagulant. Do wear a medic alert bracelet or carry a pocket card.
Anticoagulant don'ts.
Don't double your dose if you miss a day. Don't stop taking your anticoagulant without asking your healthcare provider. Don't do dangerous activities or participate in contact sports. This presentation has just introduced you to some important information about anticoagulants. Don't feel overwhelmed. You will be provided with a handout to take home with you. Thank you for listening, and remember, if you ever have any questions or concerns, contact your physician, pharmacist, or nurse.